All right. Okay. Welcome everyone to our last meeting for improving chest and breastfeeding support and prenatal care. Thank you all for spending these last couple of months with me and just being so diligent about getting in your worksheets and working on implementation and hopefully having something amazing to share that I would say this November, but it is October. And we're also going to see that obviously in the spring if you do have that as well in terms of final results. So no pressure. But we're just very excited to have you at this last meeting. We did it, we made it, and let's get to it. So per usual, just please keep yourself on mute if you're not speaking. You'll always have a time to either take yourself off mute or use the chat box if you have any questions. So we will go through introductions again, as well as some peer sharing about what you all have been through the last couple of months and talk about sustainability and just wrap up any grant details. So if each team could please share your name, pronouns if comfortable, your role in the organization, and what was most exciting about completing this project. I'll start with Alexis because you're the first on my screen.
My name's Alexis Batchelder. I work at the Regional Office of Education number 33, and I'm the prenatal to age 3 family educator and doula supervisor. I think the most exciting part about completing our project is seeing how much of a difference it's made in the participants that took our class series in regards to what they didn't know before they started the breast chest feeding class. So we had a lot of people leave with a lot of answers to questions that they had coming in. We've had people reaching out after class. So it was just successful overall, and we're excited to continue the classes in January.
Anyone else from your team on, Alexis?
No, just me.
Okay, great. I'll move on. Megan, would you like to go?
Yes. Hi, everyone. My name is Megan Barnes, pronoun she, her. Role, I am the WIC coordinator for Near North Health. And the most exciting part about completing this project was probably the demand that we experience. Sometimes with events that you put on, they can not be as successful, even though you put all of your effort and time into organizing them, but we really got a great turnout. We did a lunch and learn for our providers in the clinic setting. We also did a mom and baby group. Both had wonderful turnouts and a lot of interest from everyone who participated. So that definitely made us excited, and knowing that the hard work that we put into it was worth it.
Wonderful. Thank you for sharing. Anyone else from your team want to share
Anna's
anything?
on. I don't know if Anna wants to introduce themselves, but I
Oh,
think
they don't have to. That's all right.
okay.
Emily, would you like to go next?
You want to come back to me as soon as the rest of my team, they're
Yeah.
struggling to get on. Sorry.
Sure, no problem. Chastity, would you like to go?
Yes, so I am Chastity Mays. Pronouns are she, her. I am a birth doula and administrator for the Little Resource Center Carbondale. And I think what has been most exciting is families reaching out now to us for breastfeeding support, which was not what we expected. We wanted our groups to be more successful, but it's been individual reaching out. But it's been in those times where it's been like within the first week of someone having a baby, which is when we find they're most struggling. So that's been really nice to be able to help them get over those hurdles. And now they're still breastfeeding. So it's been nice.
Thank you. Dr. Shallot or Michelle, would you like to introduce yourselves?
Yeah, I can go first. So Shelly Shallot, she, her. I am pediatrician and primarily a newborn hospitalist with OSF St. Francis Medical Center. And I think with a few phases, but the most exciting thing was we did education for OBs, and our pre-survey, when we took our pre-survey to the 12 people in the room and asked, do you discuss the benefits of lactation with your patients prenatally? Only 8% said yes. And 58% said sometimes. And our post-survey, 100% said that they would discuss benefits of lactation with their patients prenatally. So that was awesome.
Michelle, would you like to go? If not, that's all right as well.
Sure. Michelle Compton, Peoria City County Health Department, she, her pronouns. I am the WIC coordinator here in Peoria, Illinois. And I would say exciting, along the same lines as others, but just being able to support the community from just from a consistent and I'm not thinking of the right word, but gosh, why can't I think of the word I'm trying to think of? But just like coming at it together and saying we are all here, we are all in communication, we all have the same message of support. Has been really nice. A united front. I think that's what I was going for.
No, that's definitely something we really appreciate, having any form of continuity of care in the work that you're doing. So that's great to hear. Emily, would you at least like to go for yourself?
Yeah, I can go ahead. They're coming to my office now.
Okay.
So so I would say that I think I echo a lot of the same comments when the team has gone to meet with the provider offices. The desire for those office staff to want to know more, to want to be educated on how to speak with their patients on chest feeding and breastfeeding was probably one of the best perks of actually doing this and reaching out and being able to have those conversations with the office staff and the providers. I mean, they were both very, very engaged. And we still have several to go. They welcomed us into their OB offices, into the pediatric offices. So getting that wide breadth of community engagement in this has been a great piece of the project.
And we have people from the pediatric offices who have heard from the OB offices about the stuff we're handing out, and they can't wait to get it.
That's so nice to hear. I think you all and Peoria should feel really grateful, because it's been really rough trying to get some of these OBs specifically involved, and you all, I think, are doing a great job, whether it's being a united front or just in general, these relationships you're creating. We really need those, and honestly, it's really great to see that you all are at least doing it, so we can get some type of feedback into the benefits that this actually provides for them, their teams, and their patients. So thank you all. All right, I'll move on. So just a couple reminders in terms of grant things. Your final invoice for $1,300. You can submit that invoice the moment you submit the final report. You should have gotten an email from me today with the final report link. If there's any questions about that, you can always feel free to email me. If there's any additional data or evaluation information you'd like to share that's not asked about in that report, we'd really appreciate it if you could share that. We'd really like to call out the organizations that we're working with in terms of the success that you all have shown and the work that you're doing in general, whether or not you've seen any promotion of it yet, and you might see it by spring of next year. We'd love to still uplift your work with our partners and things like that, so that people know what's going on and the need that there is around the state. So yeah, besides that, that's all that's due as of November 18th. And I will move on. So let's celebrate you all. I once again want to say a huge thank you. You all have been a great group of people to work with. It's been really nice to see all of the work that you're putting into the projects that you have. You would be surprised how many people can get these grants and not necessarily put in half the work that you all are putting in. And it's just really nice to be able to see people who are really championing this work. And yeah, so let's get into what you guys have been working on for the last couple of months. So I would like for each team to go around. You'd state the PSE change you settled on, what you've achieved so far, how you know you've achieved it, basically what you tracked, when you expect final data if you don't have it now, and what you learned about your organization throughout this process. And then at the end, if there's anything after you shared that, maybe you don't have certain data, if you have any questions for the group based off of what others have said, how did you get that data? What did you do to convince the OBs? Things like that for the rest of the group. We'd really like for anybody to share any knowledge they have about how they've gotten to certain places, so that way others can learn from that. Would anybody like to start?
He's here, she'll start.
Hello. So we have learned that the biggest thing is persistence is key when working with other providers, just kind of constantly trying to stay in contact and engage them. We've been able to go into one facility's peds and family practice and talk with their staff. We have a date scheduled to go in to another facility's pediatric staff. Gotten to work hand on hand with one of our programs here in our area that does like a birth to 5 and help their newly appointed CLS spread proper information amongst her own organization. We have worked on with our peer counselors and changing our policy and how we connect with moms, how we connect with families, and how that process is done so that it is more thorough and consistent. We have created this, I call it like a little tip sheet, and it kind of follows our continuity, like always being consistent with our teaching. And so when we go into these places, we talk about, our key terms, that it's kind of like this, help them get through this moment and then get them referred, which has picked up popularity. And what I just recently discovered has been being discussed amongst nurses in our community, which is pretty exciting for us that's something that's, an open topic. We have sent out hundreds of letters to every provider in our county and the local county, which has, brought more interest and being talked about as well. Since one of the data points that it's kind of hard sometimes to track data, but one of the data points that I thought was really interesting for us is that since being able to provide truly bilingual care and speaking to people in their native language, we've been able, and this might sound like a small number, but for us is a pretty decent increase, but increase our Spanish speaking clients by 20 people. And that has been awesome. They feel a lot safer, making sure that the person that's speaking with them is well educated and consistent in her care with education and breastfeeding. That tip sheet, she completely translated over so that it's front and back, one side English, one side Spanish. So even a provider that can't speak Spanish and is working with family can use this visual tip sheet to show the basic things like belly to belly and ear, shoulder, hip, and everything can be consistent. What I've learned about our facility here, honestly, is dedication and commitment to wanting to make things better, wanting to make it a safe, accessible place for breastfeeding education, and to be the point of that knowledge for the community as a whole. And that's an awesome thing because I know not many people get that at their organizations.
Thank you. That was a lot. And we
Sorry, I talk a lot. My
no,
bad.
I meant like you did a lot of work. That's really good.
She's very passionate.
No, and we appreciate that. I really appreciate you sharing what increases and things that you've been able to see or some successes. We really like to hear that, as well as do you know if you'll have more data in like the next month or like in the spring, February, how much more data you'd have based off of the work you've done?
Well, we'll have the evaluation data from so Effie's got a breastfeeding, chest feeding class going on last week and this week. So she'll get post evaluation data based on the client feedback there. And then they have another office
We'll have data
that
from
will have data from that pre-test and post-test evaluation. And you had asked us to look at what was their level of what was their credentials. So we're speaking to MDs, NPs, MAs, LPNs. So we'll have that information as well to be able to send with the final report.
Okay. And then did you all have any questions about for the group about what anyone else is doing in terms of how they overcome any challenges or anything like that?
My main question is how they're building their connections, so that hopefully I can use those tips to better strengthen and build our own locally.
Would anybody be able to comment on how you all are able to build any relationships and connections to do your work?
This is Shelley from Peoria. One thing, we've been building connections between agencies. And as you know, you like meet all these cool people, right? When you go out and talk to them and do all that. One thing we did is put together a listserv, like you can do it for free on Google. And then as we do different trainings or we go to different offices or we meet with different people, we gather emails and then we have this listserv. And then that's a way that we disseminate, like if we're going to do a community training, we can send it out to that. So it's a kind of a one communication stop for things that we're doing. And then it helps when you get those cold emails, you're like, oh, whatever. But it's built upon people that we've met and done or had like, you know, an event together with. So then there's the relationship component to it too.
It's a great idea.
Anyone else have any ideas on how to connect or build relationships with others?
One thing, this is Chastity. One thing that, well, two things that we did. So I've joined our hospital system, which is Southern Illinois Healthcare. They have a promoting vaginal birth and a birth equity committee, and I joined both of those. We've also been going to our they have a breakfast where they get feedback about labor and delivery. And we've been going to those breakfasts and also inviting our clients to those breakfasts to give feedback. And that allows us to get to know the nurses and providers. And then we have a free sale once a month. And we've been inviting like local organizations to table at the free sale. So that introduces them to the community and then introduces us to them. So those are a few things we've done.
Thank you all. I hope that helps your group a little, Emily and Effie. We really appreciate the work that you all are doing.
Yes, those are amazing ideas. Thank you so much.
Who would like to go next?
This is Michelle from Peoria, and I'd be happy to go next, and Dr. Shallett can jump in anytime as well. So we really worked on education piece. Specifically, we indicated education of our residents through our resident program. We just, again, wanted it to be consistent messaging, and we wanted to make sure that the audience, that we were hitting the right audience. So we felt like with our residents who are in the earlier stages of their career, and just like getting that messaging and kind of instill the importance of lactation early on could really make a big impact. So the main things that we have really done thus far, we in the first cycle of this, in this past year, we developed Peoria Pregnancy Connection, where it's kind of a one common space for a variety of lactation resources, including WIC and some of our home visiting agencies, and just trying to identify what needs there may be, and really working on developing those like genuine relationships. So instead of just like providing a phone number or talking to somebody on the phone, we have one of our outreach workers, Vanita, actually present in the clinics where the patients are being seen by the residents, so that Vanita can develop a relationship both with the participants in these programs as well as the residents, and really kind of give more meaning to the things that we're promoting. So that has been really good. And I think the cool thing is that it wasn't just like we were there last year and then left. Now they're seeing like this is a consistent thing. We're still here. This is going to be something that's integrated going forward, and we're really building on those relationships and kind of the work that we've already accomplished. And then the other piece, as far as the education, is we have one of our lactation IBCLCs from Carl Health that has been a really awesome resource in providing the educations. So she is hosting another Ready Set Baby curriculum training, and that is open to anybody that provides lactation support in our community, from residents, home visitors, WIC staff, nutritionists, outreach workers. Anybody can come to that. We had a really good attendance last time we did that. I want to say like in the 30s or 40s for the number of people attended. So we're hoping for good attendance with that again. And then as far as what we've tracked, I think Dr. Shallett may have more info on that, but we've been tracking the number of people that have been enrolled into lactation support programs through Vanita, that community health worker. And then we'll be able to track the number of people that have been trained in Ready Set Baby. Um, and as far as what we've learned about our organization. So I can say from a WIC perspective, I guess this kind of goes into the bigger picture, but it seems to be a recurring theme that we just have to really understand to meet people where they're at. And this really, I mean, it does play into lactation, because we have clients that face a number of barriers, and they're not able to really meet all of their goals without those basic needs being met. I mean, we frequently have clients come in that have no idea how they're going to get diapers, or their electric's about to be turned off. So their priority and their focus is, it might not be on breastfeeding, because they don't have the capacity to think beyond those basic needs. So I have learned, I think, that it's so important that we have answers and referral options and knowledge of different programs, like the energy assistance programs and the diaper bank and things, in order to allow that person to even, think about reaching their lactation goals. So I think that's a really important piece of it to bring up. And then Dr. Shallett, if you had anything else on there.
I think that was perfect. I would add just a few numbers that through the first cycle, and then this morning, the training of Ready Set Baby in our community for community partners, it's going to be over 100 people that have taken the training, which is huge. And yeah, good job.
So what would you say you're hoping to see from the Ready Set Baby trainings and the number of enrollees? Like overall, what do you all expect in terms of breastfeeding support to look like?
Yeah, so our Family Connects too is tracking their home visitors giving the Ready Set Baby training. Informally, I ask our families when they come in, like, because I work in the nursery a lot, like I'll see families frequently who didn't breast or chest feed the first or second, and then they're here and it's very common, they'll say, oh, I like, what made the difference? Like, oh, well, I talked to Lisha at WIC or Leash at WIC, or that they took the training, and then they're like, because once they heard that it was better for their baby, right, then they come in with more of the knowledge of how to make that happen. Also, we do track in the hospital what our actual rates are, where we have a really good report, and we have seen an uptick in exclusive lactation in our families that are served by our home visitors and in our zip code. So that's the ultimate goal, is that more people are successful. And so, yeah, that's what we look at too.
Thank you. That was perfect. Did you have any questions for the group, either of you?
I think that everybody's really love hearing all of the great work, and curious the groups that are really out in the OB offices, we struggle with that. Getting to the residents are one thing. So yeah, how you actually get into the OB offices and get the time to get in front of those people, that's a really good work that you're doing and not easy to do. I've also learned Michelle Compton is very good at managing our money and our budget, and we would be nowhere without her doing all that for us.
Gotta love a staff shout out. Thank you. So if there's anyone that has any advice on how to engage and get the time of an OB and how you're working with them, we'd love to hear. Is anyone able to share anything? All right. I will move on to the next group. Chastity, would you like to go?
Yeah, can you hear me still?
Yes.
Okay. I had to switch. I switched to a computer. So the change that we worked on was just offering culturally competent support, which is myself, a Black birth worker in our area. So we've accomplished that. And then also translation for Spanish, because on our staff, we have Spanish speaking staff now. So that's been really great. Our Spanish speaking population has definitely tripled now because we have that available. And like I said before, we have started groups, but groups just aren't as successful as individual, which we're finding we want our groups to be bigger, but I feel like someone else said earlier, like being consistent. So I think just keeping on offering the group is going to be good for families, but it's just been individual. So I just find that people are calling our office and getting that individual breastfeeding support. And we're just keeping track of the numbers. We're keeping track of how many come to group. And then we're starting to keep track of all the individual touch points that we have for breastfeeding support. And then what we've learned is that what we thought would work is not working. So groups are not working as well, but we're just going to keep on trying, because I think it's really important for those moms who are in that same space to meet each other and have each other as support. So if we can get them to come to those groups, hopefully that'll help them. And I don't have any questions because I feel like I've learned so much from what people have already shared. And I feel like we can also take that and just run with it also.
And what did you say? Would you say you learned about your organization through this process?
I would say, really, it's just the group. So like, how do we make the group work better? And I feel like us coming together, like our Spanish speaking population, myself, and our other staff, like trying to come up with what is going to work to bring the groups together. So I think just us working together to bring our different ideas is what we've learned about the organization. Like we have to make sure, one of the things that we were not doing is like making sure we have time to meet together because we're all so busy. And we've now made it where we meet once a month and we go through everything we need to go through. And just be doing that is helping our organization as a whole.
And if you don't mind me asking, why do you think the groups, what tells you that they're not working? That do you have a certain amount of people that you meet with and only a small percentage are going to the groups, or you only have a small group in general? Like what's making you think that the amount of people showing up means that you're not doing good with it?
So sometimes we don't have anybody show up.
Mm-hmm.
And I mean, we at least want 5 at each group. Um, and when we first started the group, we would have like 8 to 10, but those numbers have just dropped off. And you know, there's all types of reasons. Parents are busy, they have other children now, you know, so it's like there are all types of reasons why, but yeah, it's just the group is not, the people aren't coming to the group.
And have you all, when you say like you've heard all the reasons, have you all documented what everyone's been saying as to why they don't attend anymore? Or when people
Mm.
say no, why they're saying no?
Yeah, we have, yes. Yeah.
And then um with that, I wonder if you can, I mean, at some point, I think that's also data that's, they say there's no bad publicity. I feel like there's no bad data. Like that data too, I think is very useful, as well as in your final report in terms of, why people aren't showing up, what are the main reasons, what are like the age groups, what are like the zip codes, or are they typically working parents? Are they typically single parents? Like that data is still very useful for your final report. So even though it might feel like that itself, the specific group that you were really hoping to have more of a more positive outcome from, I think you're still getting so much good information that hopefully we always stay in contact. We can always, work with and additionally, follow up in the spring, as we said in February, to see how things are going, to see if the groups have, made an uptick based off of the weather change or something.
Yes.
But I think it sounds like you all are doing all you can with what you have. And I, for one, do not think at all that it didn't necessarily, it's not working. I think, like you said, it's just there are many different reasons, and just sometimes you might not know the exact way to fix it, but there's so many different things you can learn from that. And I think we're all still very excited to see the data you have in terms of what are things that we can all also focus on to additionally make sure our patients and our parents are all taken care of in different aspects. So thank you still for bringing it up.
Oh, thank you.
Who would like to go next? Alexis, did you go?
I have not, but I will
Okay.
go. So our focus was ensuring a stable chest breastfeeding resource and support for expectant caregivers. We serve Knox, Henderson, Mercer, and Warren counties, and out of those 4 counties, we only have 1 labor and delivery, and that's in Galesburg. So we have been teaching prenatal education classes at their location. One of the classes is specific to chest and breastfeeding. So we've done 2 series so far. Out of those 2 series, we've had 13 expectant caregivers who each had a support person with them. So we call that a success because before that there were no classes at all. So that means that 13 people plus their support person was touched by some way enough to continue to come back to the classes and using the information. So we tracked using a pre and post screening, and the top 2 would be the class increased my knowledge and confidence of the topic discussed. We did it broader like that, so we could use it for each of the classes, but 13 out of 13, so 100%, on a score of 1 to 5, rated at a 5, so that's successful for us. And then the other question, we had like 5 on each survey. The other one that I feel like is important is I feel as though this class was taught through an equitable lens, and 13 out of 13 on a scale of 1 to 5 marked 5, so we feel like that is successful as well. So our team definitely learned a lot about teaching through an equitable lens. I think that that's not something that we've focused so much on before in our new doula work that we're doing within our organization. So we've learned a lot, used resources that were given in the beginning from you, and like went through that as a team and kind of decided what things we felt like were important to make sure we were doing when we were teaching. And then we also took the time to reflect ourselves after each class, how we felt we taught as a group, and things that we could work on. And then we plan to sustain our project through the supplies that we were able to purchase with the grant funds, the teaching supplies, and then OSF allowing us to use their space for free. So we will continue our next class series in January and then in April.
Thank you. Did you say what you learned about your organization through this process?
I just highlighted that like my staff that I worked with, we learned a lot in regards to teaching through an equitable lens. I feel like that was our main focus when it came to this grant. We've already been working with a lot of our families on chest and breastfeeding, but I think it was honing it in to what equity looks like in breastfeeding. We had a lot of questions about like breastfeeding in the workplace and different things like that during class. So I feel like people were very engaged. We had people that attended our first series breastfeeding class come back to our second series class to get more before they had their baby, just to get a refresher. So I felt like it was successful. Yeah.
No,
And my staff know a lot more than what I feel like I gave them credit for. Like I know they're very intelligent, but it was really cool to see them like teach. Home visiting world and one-on-one is a lot different than being in front of a group of people. So they did a very good job.
And I would just like to say, I really appreciate you mentioning how much you all were able to kind of change the way you see things throughout the process. I think that's such a difficult thing for a lot of organizations and sometimes different staff members to change what they may have been taught in medical school or nursing school or what have you. And so to change it based off of, little public health efforts like ours, it really means a lot. And so I think it says a lot about you all and the amount of help you really want to bring to the people you're serving. So thank you.
Yeah. Thank you.
And did you have any questions for the group, or does anyone have any questions for Alexis?
I was gonna throw out there, like we have a lot of good relationships with the OBs in Galesburg because we do baskets for them once a month as like our doula team. So I don't know what anyone's funds look like. We like didn't use this funds clearly, but it gives us like a one-on-one time for them to like see our faces. And so when we go up for births, like they always remember us. And so they're just very easy to talk to. So just something, I feel like they're always in work mode, but taking them out for a second and like giving them something that is like joyful, but not asking a work question, if that makes sense. Yeah.
Everyone has time for a free basket.
Right?
I hope someone found that helpful. I definitely did. Now I know to bribe them all. I will move on. Megan, I believe you all are
Yes.
to go. Okay.
Yeah. So we had 2 different PSC change. One of them was to host lunch and learns to our healthcare providers. So it was targeted towards OB and PED providers, but everyone was invited and encouraged to attend at our sites. We hosted it at 2 of our biggest sites. In total, we had 26 attendees, which was wonderful. it was just like a basics about breastfeeding, and we also offered the IPHI resources that we got. And then we made like a resource list for lactation care in the community beyond WIC services. So if patients were already receiving WIC care and breastfeeding support, just ways to get it outside, whether it was virtual, like a call line, things like that. And out of the 26 attendees, 3 people expressed interest in doing the CLS training, which we often send our providers to. We have sent 1 so far with our grant funds, so that was a little bit unexpected, but very exciting that someone was interested in furthering their breast chest feeding knowledge. And for the future, we hope to plan more lunch and learns because clearly it gets the conversation started about breastfeeding and gets people excited about it. And what we tracked, we gave out a survey on how many patients providers were speaking to about breastfeeding out of 10 patients. So we're going to measure the difference after 2 months of asking them to offer the breastfeeding resources that we provided to their patients and just see if it helps them open up that conversation more about breastfeeding because some of those resources were wonderful and definitely get the conversation going as well. And we learned that providers definitely kind of common theme here that they have limited time to spend on providing lactation care to their patients. And it's only often discussed if the patient really has questions. So this is like way down the line, but I was just thinking if we could get more CLS providers dispersed throughout our clinic setting, more people would be educated and potentially have dedicated time to have touch points with patients during their pregnancy period and postpartum visits to ensure they're receiving lactation care since the OBs and peds are already as busy, very busy as it is. And then for sustainability, just sending these providers to CLS training, building up their confidence and providing good support for breast chest feeding parents. And then hopefully we'll do more of those lunch and learns. And everyone who attended the lunch and learns got the access to those resources. So the handouts and then the providing or where else to receive breastfeeding support outside of the WIC clinic. And then our other PSC change was our mom and baby groups. So our goal of that was to bring it back. It used to be a thing at WIC, but COVID kind of messed things up with group classes. So it's been successful in the past. We decided to bring it back and we wanted participants to feel that there was like a safe space and, kind of build community a little bit. So it was taught by our 2 breastfeeding peer counselors. We had 8 pregnant participants and some of their family members show up for the mom and me group. And we had like snacks and there was cute music playing and we had a slideshow and we just discussed a lot of breastfeeding basics just to kind of mention what some other people have struggled with that they mentioned on this call. I think what helped us a lot because we've had programs that we've run that have not been successful like marketing wise and people don't show up as much as we'd like, but what was really great about this one, which took a little bit extra time, but we polled a lot of our pregnant patients from WIC in their 9th month of pregnancy. And we actually gave them a personal call and said, hey, do you want to come to this class tomorrow or in 2 days? So I think that helped a lot because sometimes people don't know what they're doing a week, 2 weeks out. They might see a flyer and kind of ignore it, but actually personally inviting some people to the class, I think helped a lot. So we had a wonderful turnout that way. They were engaged, they were chatting we did a survey with that. So we discovered that a lot of them were confident in breastfeeding and a lot of them wanted to breastfeed their baby. We found that out of the 5 out of 8 that have delivered already, 100% of them has initiated breastfeeding. 80% of them are mixed feeding their babies and 20% are chest feeding exclusively. So I think it helped to build up their confidence, definitely build that community. And I think that's what we learned is that community is important and that there is a demand there to learn more about breast chest feeding. We have the space, we have the staff, and we have that time to dedicate our efforts to meet the demand. So sustainability wise, we're hoping that we're going to plan quarterly mom and baby group classes run by our peer counselors with the same lesson plan. So it's not like we're changing things up too much. It's just going to be like a breastfeeding basics class. And hopefully we continue to get our new pregnant participants on the WIC program, and they'll cycle through. So we'll always have new patients to offer the class to. And we also taught the class in Spanish. I forgot to mention that. So that was great.
That is great, Megan. Thank you for sharing. I know you and some others pointed out like being persistent and overall making sure you have that community. I think also a lot of what I'm seeing from a lot of the successful groups that we've worked with is also that ability to personally reach out to people. I think there's a lot of places that don't necessarily have the time or the bandwidth or the staff time, the staff overall, to do what you guys are doing, Megan, or what I know Peoria has done. And that comes from you all too, just being such great champions and finding that time to really personally reach out, because I do see a lot more success from those groups when people feel like, wow, they really reached out to me and said, you know, oh, I care that you're in your 9th month or you're in your 8th month, and we'd really like to invite you to this class, or we'd really like to invite you to this event. So I will say for others, you know, if that's something that you can do, you have staff time to do it. I think personally reaching out to people is really impactful, and we've seen that from a lot of organizations. So thank you. And
Yes.
did you have any questions for the group, Megan?
No questions.
Okay. And did anyone else have any questions for anyone else about any of the projects that you've just heard about? All right. Well, thank you all for sharing. It sounds really great. And it really sounds like you all have actually put in a lot of passion into your projects. So it's just going to be even more exciting, hopefully in February when I reach back out, to see where you all are at. As of right now, as a refresh of, you know, the 6 stages of PSE change, policy system environmental changes, we previously asked, what stage did you think you were in? And I'd like to ask, what stage do you think you are in now? And how much growth do you expect by February? So if you could put 2 numbers in for what stage your PSE changes in now in the chat, and how much growth do you expect by February, whether it's the same phase number or the next phase, if you could put that in. So if you think you're in phase 3 right now, but you'll be in phase 4 by February, just put 3,4 in the chat. And I'll give everyone a minute or so to go ahead and do that. I'll read it off as well. Where I think a lot of you are at are 3 and 4. And so if you think you're at 5, great. I'm not saying you're not. I'm just doing it from my perspective. So I'll read off phases 3 and 4. Phase 3 is the PSE adoption phase and initial implementation with your equipment installed, your plan finalized, or your policy passed. Phase 4 is implementation overall, marked by an ongoing and increased engagement to maintain or expand your PSE change. And then phase 5, if you happen to also be in that, institutionalization of PSE change, marked by changes in social norms, so any success you might have, and a decision-making process that prioritizes health and equity. 2 and 4 by February. I love that jump. 4 and 5, 4 to 6. Wow, you guys are gonna make some good progress by February. I'm excited. 3 to 4, nice. 4 to 5 or 6, being optimistic as well. Well, I think it's good to be optimistic. I think a lot of you are doing things that other people would say is optimistic. So just a big kudos to you all for knowing where you're at and hoping to go a lot further than where you're actually at. So thank you. Moving on. So as we kind of end today, I want to hear a little bit about what you are planning to just sustain this. What of your PSE change? Was it a policy change? Was it a systems change? Was it multiple? And that's it, just those 2 things. So if you could let me know what your plan is and what type of PSE change it was. Because we can get into any of these questions as well if you have the time. I will choose Alexis, you're on my screen. So just your sustainability plan, and then these questions on the screen.
So our
I'm pretty much
sustainability,
familiar with what type of PSE change you made, so you don't have to
yeah.
answer.
Our sustainability plan is really just going to be utilizing the things that we purchased to continue classes, keeping up with our collaboration with OSF St. Mary's, utilizing their space for free. We have a good relationship with their lactation consultant that they have on staff, and their neonatal nurse practitioner. So they have attended our classes as well, each of our classes, so they've been a big help. And so I think building relationships is just going to help us continue our classes and utilizing the things that we purchased with the grant money. Um,
Are there any specific people at your organization who are key to making sure that it stays in place?
So really, I think it's my position, not so much me, but my position. We didn't provide doula services before, so I'm the first one in this position while we're providing these services. So it's kind of nice to be able to create and do as I see fit for our program and our services. So I think that if I were to ever go anywhere or anything and this position was filled, it would just be part of our job description to host these events and stuff for our community. So I think that it will just continue on with the job.
Thank you.
Yeah.
And one question I have for you as a person, what do you think was most helpful about this learning collaborative?
I think listening to other people's ideas and what they're doing. I think we just get in such a routine of um doing the same things because that's what we know. So it's nice to hear what other people are doing in different areas and seeing what works and getting to be creative.
Thank you.
Yep.
Megan, could you go next? What was your sustainability plan?
Yes. So sustainability for the lunch and learns was to always make sure that providers have access to the handouts, whether it's the IPHI virtual handouts or the other handout that we created, and then continuing to send providers to CLS training as often as they show interest so that the breastfeeding knowledge is sustained as they meet with patients. And then the other sustainability for our mom and baby groups was just to make it a part of the breastfeeding peer counselor duties where they run one once every quarter so that we can continue to get new pregnant participants that cycle through the program before they deliver and get them into a group class.
And who are key staff to help you make sure that that keeps happening year after year?
I think we will work on that moving forward on what that looks like and how we can like really implement that. But definitely Anna and I will work together to create the sustainability of like the peer counselor's job description. I feel like we could do that in coming years moving forward.
And what did you find most helpful about the learning collaborative?
Kind of lit a fire under our butt, honestly, to make some change. Like sometimes we can be so stuck in our day-to-day duties, but to receive some grant money and some motivation to make some change is really helpful. So I think just, having something organized that helped us push some great change was the best part about it. And we did make some great change.
Thank you. Chastity, would you like to go next?
Yeah, so sustainability is just the education of all the staff. So myself as the Black breastfeeding person, I mean, I'm gonna be here, but one of the challenges is that we need at least one other person to be trained because, just the relying on one person is not good for anything. Um, but we have developed a relationship with SIU. And so starting in January, we will have one intern and more volunteers. So that's going to be helpful for our whole organization. We're so excited about that because, young people are very motivated and excited. And the key staff of the organization is myself and then Yaya, who is our Spanish interpreter, but she has volunteers coming in next in January too. So we're excited about all of that. And one thing that I could do as a leader, I think, is just making sure that the education is there about breastfeeding. So those once a month meetings are going to be very important, and making breastfeeding on the agenda all the time is going to be what's going to keep us going.
And I think it's impactful how much you actually go out of your way to go to these meetings too, Chastity. Like you go to these other events and try and, I'm sure that's not always on a weekly schedule, a weekday. So you might be
Yeah.
taking time out of your weekend to do that. So that's also impactful that you all do that.
Well, thank you.
And what was most helpful for in this learning collaborative for you?
Oh, I think just learning about what everybody else is doing, because we'll be able to take a lot of these ideas and bring them to our area. So it's really helpful hearing what everybody's doing throughout the state.
Thank you. Michelle or Dr. Shallot, would you all like to say what your sustainability plan is?
Sorry, Margaret. So can we go next? Because we have
Go ahead.
a 1:30 meeting. So I'm gonna
Yes,
let
go
Emma
ahead.
talk.
So as for sustainability, besides the fact that we have made policy changes directly with connections to our new pregnant mothers, like in our WIC program, it has become a basic expectation of employees here in the health department, especially in our women's divisions, where that breastfeeding education always is consistent and on point, and what we try to spread. As far as working with other organizations, making that part of a regular yearly commitment of going out and updating and re-educating their staff. The most impactful thing as from all of this is being around people with their ideas as well. Sometimes we, being in a small area, aren't exposed to other like-minded people in this area, and so it's been really helpful. Key staff, myself as the IBCLC, my WIC supervisor Leanna, my director of nursing Emily. That's how we are able to make this sustainable in our organization, making sure that it is consistent, it is the expectation, and that things continue on.
Thank you. And I know you all have to go, but it was a pleasure having you. And
Thank you.
Michelle, could you all go next? I know if you want to do 1 minute, that's fine. Again, I know you all probably have places to go as well.
Sure. Yeah. I think one of the keys to sustaining it is incorporating it into new hire orientation. Like from a WIC perspective, I easily can incorporate Ready Set Baby into the training for all of our nutritionists. We already incorporate the certified lactation counselor or certified lactation specialist into the nutritionist position. We have now, since this started, we've added a nutritionist 2 position, and the requirements for that nutritionist 2 position at WIC is that they obtain their IBCLC credentials within 18 months of hire of that position. So that ensures that we will have an IBCLC on staff. We have one right now, and then we have one of my nutritionists going through the IBCLC mentorship program, and hopefully doing the exam in the spring. So I think if you can incorporate this into maybe like the orientation for residents and just have it be an ongoing, means of orientation material, I think that could be really helpful.
And then what did you all find most helpful about this learning collaborative? Thank you, Megan.
I think just the continued conversation and built relationships. I mean, we have more open communication and are closer now with both of our major hospital systems than we ever have been in the past. I talk with our home visiting agencies on a regular basis. We get referrals daily, like in and out of WIC. all around lactation. So I think the increase in relationships, partnerships, and referrals has been tremendous.
Thank you. And that's what we want to hear, that you all are learning from each other. Thank you all so much for the last couple of months. I know you have to go, but I just really wanted to say we really appreciate you being amazing breastfeeding champions. And I hope you all have a great rest of your day. If you have any trouble or questions about the final report, just email me or call me, whichever you need. Thank you all so much.